A patient on a ketogenic diet has been living with IDH1 mutant glioblastoma for over 6 years. Warning: the material presented is descriptive in nature and reflects the experience of a single patient with alternative treatment and should not serve as a guideline for action due to the uniqueness of the observation. Do not engage in self-treatment. Seek help from doctors. A recently published report in the journal Frontiers in Nutrition represents a preliminary assessment of the use of ketogenic metabolic therapy, KMT, without chemotherapy or radiation interventions in a patient diagnosed with IDH1 mutant glioblastoma, GBM. In this particular case, the patient's tumor contained a mutation known as IDH1. This mutation is acquired randomly and is known to improve overall survival. Thus, the results obtained are especially relevant for other patients whose tumors contain this mutation, according to Thomas Seyfried, a professor of biology at Boston College, co-author of the report and lead researcher who has long advocated for the benefits of the ketogenic metabolic therapy, KMT, for treating diseases. Since glioblastoma, like most malignant cancers, relies on fermentation for energy synthesis and survival, simultaneous restriction of fermentable fuels such as glucose and glutamine, while increasing non-fermentable ketone bodies, offers a non-toxic therapeutic strategy to impede the growth of this brain tumor, Seyfried said. Further research will be necessary to test this hypothesis in other patients diagnosed with GBM. Glioblastoma kills approximately 15,000 people each year and remains virtually untreatable. While the standard of medical care has shifted towards new immunotherapy methods, the median survival for GBM of 11 to 15 months has not significantly improved over more than 100 years, according to the co-authors. Several high-profile cases involving public figures illustrate the deadly progression of glioblastoma. In July 2017, John McCain was diagnosed with glioblastoma at the age of 80, and he passed away in August 2018. Edward M. Kennedy lived for a year after being diagnosed with GBM and died at the age of 77. The son of the current President of the United States, Joe Biden, Beau Biden, was diagnosed with a brain tumor at the age of 44 in August 2013, and he died in May 2015. The current standard treatment for GBM includes surgical resection, radiation therapy, and chemotherapy, which, as experience has shown, leads to significant toxicity. At the same time, it is difficult to initiate large-scale clinical trials for alternative treatment methods. Therefore, such individual cases present genuine interest for researchers. In this case, a patient was diagnosed with glioblastoma in 2014, after which he rejected the traditional standard of treatment and instead began a self-implemented ketogenic diet, low in carbohydrates and high in fats, in an attempt to manage his cancer. It was found that the patient's tumor continued to grow very slowly for 3 years without the expected vasogenic edema until 2017, according to Seyfried and his co-authors, Boston College researcher Purna Mukherjee, medical doctor Aditi Shivane from Plymouth NHS Trust in the UK, U.S., dietitian Miriam Calamian, Joseph Maroon from the University of Pittsburgh, and Giulio Zuccoli from Drexel University College of Medicine. In 2017, after experiencing a threat of brain compression, he underwent appropriate surgical intervention, with a necessary tumor sample taken for histological examination. This confirmed the previously established tumor diagnosis. Furthermore, genetic analysis confirmed the IDH1 mutation. After the surgery, the patient continued to adhere to the ketogenic diet to maintain low glucose ketone index (GK) values, indicating therapeutic ketosis, the researchers report. In light of the ongoing slow progression of the residual tumor, the patient intensified his complementary metabolic therapy (CMT) starting in October 2018, incorporating mindfulness techniques to reduce stress. Currently, MRI shows slow interval progression of the tumor, and the patient is alive with a relatively good quality of life at the time of writing this article, June 2021. The age of the tumor is 82 months from the time of the initial diagnosis. We were surprised to find that CMT can work synergistically with the IDH1 mutation, simultaneously targeting two major metabolic pathways necessary for stimulating GBM growth, Seyfried said. Glucose drives the glycolysis process, while glutamine drives the glutaminolysis process. No tumor, including glioblastoma, GBM, can survive without glucose and glutamine. Our research has revealed a new mechanism by which acquired somatic mutations act synergistically with a low-carbohydrate, high-fat diet to facilitate a long-term fight against fatal brain tumors. Despite the overwhelming interest in such individual clinical studies, the co-authors note, we cannot predict whether the therapeutic response to ketogenic metabolic therapy, KMT, observed in our GBM patient will also be seen in other patients receiving similar GBM treatment. For those GBM patients who are unfortunate enough to acquire a spontaneous IDH1 mutation in their tumor, medications targeting glutamine will be necessary, used alongside KMT, to reduce tumor growth. The researchers noted that additional studies they conducted showed that simultaneously targeting glucose and glutamine availability using KMT and the pan-glutaminase inhibitor known as 6-diazo-5-oxo-L-norleucine, DON, could significantly extend survival in preclinical syngeneic glioblastoma models in mice. Previous studies have shown that ketogenic diets can facilitate the delivery of small molecule therapeutic agents across the blood-brain barrier without toxicity.